Hi, and welcome to Cleveland Clinic Ultrasound course. My name is Dugar. I'm one of the staff physician at Cleveland Clinic and director of point of care ultrasound. Here we will be discussing basic cardiac ultrasound. There are certain things that we have to be aware of when acquiring images. Make sure your patient is appropriately positioned. As much as you can, try to get them in left lateral decubitus position. If you're getting subcostal views, use supine. They can always flex their hips and knees to soften their abdomen. The probe we will be using is a cardiac probe or a phased array probe. Make sure there is enough gel to be able to get the ultrasound transmission to the tissue. Be aware of the image orientation and always try to see if you can avoid the lung as much as you can. So this is the cardiac probe or a phased array probe. The frequency is 2 to 5 megahertz. It can penetrate up to 35 centimeter. And the reason we use phased array probe is because of the small footprint it can fit between the ribs. Image orientation. By convention, the echo, when we are performing an echo, the screen indicator should be on the upper right, as you can see in this image. It is very standard for cardiology and for critical care medicine. Some places may have the pointer in another place like the left upper, but for most, it should be in the right upper part of your screen. Here we will talk about the zen of imaging. It's very important for you when you are assessing the heart with an ultrasound to be able to orient yourself to the 3D positioning of the heart in the chest cavity. Any abnormality in the chest cavity, be it associated with the heart or lung, will alter the position of the heart. So when you are performing it, try to visualize how the heart is situated within the chest cavity, and it will make your life very easy. Another important point is small movement is big results. Try not to move too much. Rocking, tilting that we will be talking about are very important to get the most optimal image. So rocking, the motion in the long axis of the probe. What we mean by long axis, if you have a probe that has a longer side and a shorter side, the longer side is where the long axis passes through, and the movement is keeping the axis the same and rocking it back and forth, as you can see in this image. Fanning is actually the same thing as rocking, but moving towards the short axis of the probe. These movements are very important when we are trying to scan the heart. Sliding, in this, the axis changes, so you are basically sliding the probe on the chest cavity, and that will give you very good images of the heart at different sections. And rotation, this is going to be very important when we are assessing the heart, and it's basically you keep the axis fixed and you try to rotate the probe as shown in this image. As I just said, these movements are going to give you good cross section of the heart at different planes to be able to assess the heart better. So long axis or parasternal, short axis is parasternal again, while apical 4-chamber views are obtained in apical and subcostal view. As you can see that there are sagittal plane and coronal plane, and all you have to do to move from sagittal to coronal is rotate the probe by 90 degrees. The first view is the parasternal long axis view. The indicator is pointing towards the 11 o'clock position or towards the right shoulder. A good parasternal long axis view is where your septum is parallel to the surface of the screen. You are able to see your RVOT, your LVOT, your mitral valve, aortic valve, and LV cavity. Now this view is very important to be able to assess the pericardium, the left pleural space. It gives you a good idea about what the LV size and function is and how is the LA size. It's a great view for people who are in shock or respiratory failure because two of the major valves, which is the mitral and the aortic valve, can be visualized here. Now here is a good example of a really nice parasternal long axis view. As you can see, the septum is parallel to the top of the screen. You are able to see the aortic valve, mitral valve, and you get a pretty good idea about how the LA and the LV looks. The next view is the parasternal short axis view. Now we rotate the probe 90 degrees from parasternal long axis, and the pointer is pointing towards the left shoulder or towards 2 o'clock position. There are multiple sections that can be obtained of the heart in this view, but the one that we prefer is at the papillary muscle level. This view is great again for pericardium, for your LV function, Great view to look for regional wall motion abnormality and septal kinetics when you're assessing for pressure or volume overload of the right ventricle. Again, this is an example of a nice parasternal short axis view. What you can see is the two papillary muscles and a good contraction of the left ventricle. One of the most important views in critical care echo assessment is the apical four-chamber view. This view is obtained by having the probe at the apical impulse point. It's usually found right below the nipple at 5th or 6th intercostal space. The indicator is pointing towards the 3 o'clock or 4 o'clock position. Again, very good view when you are assessing the RV and the LV function, both size and function. You can look at the septal kinetics and gives you assessment of two of the major valves, which is the tricuspid and the mitral valve. Here is a good example of a apical four-chamber view. You can see the LV. It's not foreshortened. You can see the bullet shape of the LV that we always try to achieve. You can see the mitral and the tricuspid valve. This is very common to see the RV free wall interference, and that can be overcome by another view which is called an RV focused view. The one view that we use a lot in our ICU patient, just because when they're on positive pressure ventilation, the lung inflation may not be able to provide us with other views that we already went over. And that's why I try to ask all to master this view, which is a subcostal view. Here the probe is again pointing towards 3 o'clock position. This is usually done in a supine position, and the grip that we use is called the remote grip or the knife grip. And what you try to do is assess the pericardium. Good view if you cannot get other views to assess RV, LV function and size. This is a good example of the subcostal view where you can see liver on top, followed by RV, your tricuspid valve and your LV. Next view is the IVC view. We just rotate the probe, which was pointing towards 3 o'clock in the subcostal view, by 90 degree, and you get a 12 o'clock with the pointer pointing towards the head of the patient. Good view to assess the IVC size and the respiratory variation. This is a good example of the IVC, and you know this is IVC because you can see it entering the right atrium. You have a hepatic vein that is draining, and you can see during respiration not much change is happening with the IVC size. Again, closing comments, acquisition and interpretations are key. Be very goal oriented, try to figure out what are you trying to ask when you're performing the cardiac ultrasound. Try to overcome the technical issues, use gel, use the right probe, try to get them in left lateral decubitus position. Very, very important, mentally visualize the heart. Confirm the findings that you are seeing in multiple views and have fun with your new skill. Thank you. Have a great day.